Hi, Karen Damshin from Damshin Financial Planning. This week, we're going to have a health insurance update. Last week, we had some big news from President Trump when he announced a healthcare framework that appears to be aimed at trying to lower costs and, quote, holding big insurance companies accountable. Some of the framework of this new Healthcare Act look very similar to the framework that is already in place for the Affordable Care Act. For example, the ACA, as it's implemented today, includes public data on claims denials and insurance overhead, this plain English insurance coverage summaries. Those have all been around for a number of years. And Trump in his first administration implemented that requirement for hospitals and insurers to reveal prices, so that kind of pricing transparency. We did have prior administrations that were making payments to insurers for the cost sharing reductions, and it looks like those are potentially coming back. Some of the other provisions that may be in that healthcare framework, though, sounds like a big departure from the Affordable Care Act the way it is today. And it was not clear from the summary that was released exactly what is meant by this proposal to send the money directly to the American people. We don't quite know what that looks like. It claims that it would allow Americans to use extra taxpayer-funded subsidies to buy the health insurance of their choice, stating that perhaps you would save 10 to 15% a month. And in a year where we saw 20 to 30% rate increases, I don't know how ultimately that really feels on your bottom line if the health insurance is still very unaffordable. So in recent months, we've had some congressional Republicans who proposed a few policies to potentially expand or maybe even fund health savings accounts for folks. But those proposals have been all over the board and look very different from one another. And just no clear kind of guidance of exactly what would happen with that. So the video that was released, the plan that we've seen is fairly vague. And without knowing more, it's impossible to say what the implications may be for folks who maybe have pre-existing conditions, who are relying on those protections built into the Affordable Care Act, guaranteeing them the ability to have health insurance despite pre-existing conditions. So this release definitely leaves us with lots of questions that I don't have answers for, but I've definitely been hearing your questions about this. Trump RX was also mentioned yet again, and I have yet to see any hard and fast information. There's still no information about these 300, 400, 500% lower drug costs that we're all supposed to be paying. So nothing concrete yet, but it looks like this administration is going to continue to try and move forward. However, I do not see relief in the near future for those of you who maybe ended up having to make some decisions about health insurance this year because it was totally unaffordable. As always, I am going to keep you posted and up to date with the latest news as I get it. And I'll be back in your inbox next week with another update.